Hey everyone, welcome to today's webcast, Healthcare Connect Fund for the funding year 2020. This is Matt Roberts, the practice lead for the healthcare division, if you will, at Juniper Networks, and I'm honored to be here. I'm partnering with Bytespeed to give you some updated information as it relates to the 2020 funding year relative to the HCF program. Some of you may or may not be aware of what the Healthcare Connect Fund program is. So at a high level, this is what we'll cover today. From an agenda perspective, we'll talk about the overview of the program, who is eligible and what the impact is around taking advantage of the fund, what is eligible, what the filing calendar year looks like, why MICTA, which we'll talk about, and why I've inserted them into this particular agenda, and how to get started and what to think about through the particular process. Those of you that aren't familiar with the Healthcare Connect Fund, it's a universal service program that's administered by USAC on behalf of the FCC. Some of you may be aware of E-rate. It's very similar to E-rate from a seasonality perspective, but it is obviously a program that is for rural healthcare organizations, and it is the newest component of the FCC's rural healthcare program. What it consists of is a little over $600 million every year that's available to healthcare providers. You'll see in this deck, we call them HCPs, for reduced rates on telecom services and broadband access, so equipment and services. And what this provides is a 65% funding for eligible expenses that's related to connectivity for the individual rural HCPs and consortiums, which is a new way of filing, if you will, which we'll talk about shortly. And it can also include some non-rural healthcare providers as well, if the consortium, the makeup, if you will, of the organization has a majority of rural sites, meaning there's 51% rural and 49% urban. And the overall goal of the program is to improve patient access, reduce expenses, expand the reach, and increase efficiency. So how can people get better access to digital care? How can you cut down on duplicate testing? How can you perhaps drive maybe a telemedicine or a telehealth visit when a provider may have to drive a significant distance to treat someone. So all different parts of the program. It's exciting because rural healthcare is underserved. And so this is a component that will hopefully help build more robust networks and help really build up that lifeblood of the organization so that it does expand its digital transformation initiatives and helps really at the end of the day improve better care, control costs, experience, and a whole assortment of different things. As we talked about just a few minutes ago, so really what's the goal? So you look at it, so you get patients and providers, you've got to make sure you've got the right data at your fingertips, right? And we're seeing more and more now with COVID-19 pandemic, unfortunately, the importance of remote visits. And so what I would say here is that this particular program, in addition to the telehealth program, which is also administered on behalf of the FCC, which was $200 million recently due to the COVID pandemic, is allowing hospitals, allowing healthcare providers in general to drive out better networks, if you will, to drive care over distance. There's expenses that are related to all this, right? So travel time, as I mentioned a little bit earlier, that's affiliated with trying to get from place to place. There's also promoting the exchange of digital records, right? Or electronic medical records where patient information can be shared much faster now over, right, the electronic health record across distance. And then also there's an angle of this where you've got different areas to expand your reach. So referral services that can now exist more functionally, if you will, and they're less disjointed across geographical regions, right, based on urban and or rural settings. So when we get down into the eligibility and the impact of the program itself, what you'll see is that eligible healthcare providers can apply as individuals or part of a consortium. So those of you that are familiar with the program today might want to check at an organizational level on how you are filing. If you are still filing as an individual with your eligibility on your Form 460s, and we'll go through those forms here in a little bit, you might want to rethink the way that you are filing, especially if you have multiple organizations that sit under the mothership or the umbrella org. And let's say you've got several clinics in a hospital, you might want to form a consortium, and you, under the quote unquote filing type of a consortium, can be eligible now to receive more types of equipment and services for this 65% subsidy. Okay, so it's something that you'll really want to look at. And as I mentioned a little bit earlier too, is that there's an annual cap of 604 million, right? So it's a little over 600 million that's under this particular program to help, again, these organizations drive out better broadband connectivity in the facility, through the facility, and across the facility and the consortium to better, again, assist in digital efforts and driving better digital care. So who's eligible? If you look here on the list, you've got public nonprofit hospitals, less than 400 beds, rural health clinics, community health, mental health centers. You've got health centers serving migrants, skilled nursing, post-secondary education institutions, teaching hospitals, medical schools. So the kicker here is that you've got to sit in a qualified rural county, if you will. And you might have some questions on, well, how do I know if I actually am eligible for this? There's some tools that are available we'll share here shortly in this presentation that will allow you to understand kind of where you sit, and if you sit within a rural census tract that is approved by USAC on being deemed eligible. And so it's a process that you want to make sure that you understand. It's a process that you want to fully do due diligence on to understand whether or not you're taking advantage of the funding today or not. You might be simply taking advantage of the device and the circuitry that's in place, but not going beyond that, where you now have an opportunity based on your eligibility, determining that you could obtain up to a 65% subsidy on, again, hardware as it relates to switches, routers, even firewalls for infrastructure and the services that are associated with that. And we'll talk about that here in just a second. So everything over here on the right, as it relates to the eligible services and equipment, and this comes directly from, obviously, the USAC website under the Healthcare Connect Fund, you'll see how things in the past, when you filed as an individual, are a bit more limited opposed to now filing as a consortium, where there are more categories that are funded or fundable under the consortium filing type. And so, as I mentioned a little bit earlier, what we're talking about here in particular is making the network more functional so that you can drive better digital care and collaboration across the consortium. But it's also the network equipment that becomes the lifeblood, again, of the organization. And so, essentially what comes down to here is, again, switching, routing, firewalls, anything that's used in the connection to push broadband and make it functional throughout the consortium. And so some of the services that we talked a little bit about that typically go hand in hand with, again, network, is the design of the network, the engineering / construction of it, maybe even in the installation and the ongoing operation of the network. It's all eligible for support as well. So I just encourage everybody to investigate whether or not they're taking advantage of this today, and then step back also on top of this to understand, what does my infrastructure look like today? Am I in a position where I believe I can, sufficiently scale and I can accomplish what I need to be able to accomplish in the next couple of years? Do I have end of life and support equipment that needs to be refreshed? These are all things to start to consider as, again, you're rolling out new projects and you're doing different, engagement activities, if you will, to drive better, better experience in your hospital and across the clinics and the consortium. But again, things to think about as you're in here and you're starting to understand where you might be able to obtain some funding from the federal side. Now, as it relates to the funding year for 2020, it was a bit of a change. And so I want to point out here, and again, all this information is publicly available, again, on the USAC website. And so one thing that we did see happen this year, obviously, was the COVID pandemic. So the window originally was going to be closing for your funding requests on April 30th. That was pushed out to June 30th. So there was a change there, naturally, because of the shifting in focus and being able to handle the telecom and the telehealth requests that were coming in that were aligned with the FCC program and funding for, again, COVID initiatives. But needless to say, the window, besides that change, it was relatively the same as prior filing years, right? And so one thing to pay attention to within this particular calendar year, as you look to either wrap things up this year or you're starting to look perhaps at 2021, and if, again, you're still exploring or you haven't even started exploring, again, this is a good way to set yourself up for knowing what to do as we approach 2021 and how Bytespeed and Juniper Networks can help. But know the calendar. That's one thing that I would encourage you to do, because again, if you look at January 1, your first day for applicants to request services, Form 461, which interestingly enough, we'll talk about that here in a few minutes. You can become eligible through a lot of the calendar year, and that's a Form 460. But when it comes to actually submitting your funding request, meaning that you believe you've got a project or projects that are eligible and can be funded through the Healthcare Connect Fund, that you would need to submit starting February 1 in a traditional window of like what this year was going to be of April 30th, but now extended to June 30th. Once that window closes, then you're essentially out of luck, and you're going to need to file the next calendar year. So be sensitive to the dates, know those dates, and also realize that funding commitment letters, which will come back after a review period of once you have filed those funding requests, the Form 462s, will take several months. And so you typically would get a funding commitment letter back somewhere right around first quarter, typically of 2021, as it relates to this filing calendar year. Expect something maybe towards the same for for future years, assuming, the pandemics start to, subside, or perhaps we don't run into something like we have in a tough year of 2020. So anyway, I want to point that out there as it relates to the calendar. One thing that I will also introduce here too is an interesting organization who we've partnered with, and Bytespeed has partnered with, that's headquartered up in Saginaw, Michigan, and they've got thousands of members nationwide. Members consist of healthcare organizations. They consist of K through 12, higher education, state and local. And so what MICTA, Michigan Collegiate Telecommunications Association, focuses on is quality products, services that are pre-vetted to members at a better volume pricing, to help organizations understand how and where they could be saving money through technology acquisition and services. And so MICTA also does a fantastic job at monitoring telecom and technology legislation, also watching regulatory processes. They've got folks who monitor grant information, and to help organizations understand how they can monetize that. And so they do a lot of really, really good work to make sure that their members' needs are met, right, as it relates to technology and or even processes and knowledge that comes into play, right, through particular processes of, again, acquisition. The other advantage for MICTA members here is not only that, but MICTA members don't have to file a Form 461, so a competitive bid or an RFP. So this is very, very unique in this particular industry. And so the members, once you join MICTA, you can use an existing MICTA discount MSA to bypass a Form 461 or a bid process. That saves time, it saves money, it saves resources, right, that are all involved in all this. And so what we'd encourage is that if you aren't familiar with MICTA, it is something to look at. We would be more than happy to bridge a meeting so that you could meet the MICTA organization Healthcare Connect Fund consultant. His name is Gary Green. I've got his information in this deck here in another slide or two. But there is a monetary value that's saved not only for going out to bid, but there's also a time. And so as you saw in that filing calendar year, the calendar year is time sensitive, right? And so if you have pre-vetted technology and understand what you need to replace, or perhaps where you have opportunities for upgrade, you can work with Bytespeed and Juniper Networks and MICTA to essentially build a bill of materials without having to go out to bid and essentially submit that Form 461 and wait for a lot of responses, and to gather those responses through that particular process and then to make a decision. So we've tried to create an easier button, if you will, to expedite the process flow and to help organizations get so that they can submit their Form 462s much faster, opposed to waiting around and possibly missing, the filing window and then having to do it the next or the following year. I want to point out that the first year membership with MICTA is free. No term commitment. There's no commitment at all. In fact, that they tell you is that if you don't see value after the first year, you can cancel, and there's no clawback. There's nothing that you have to do. Year two and plus is if you've got over 300 FTEs in the organization as a whole, it's $200. Not per person, it's just $200 for the organization. If you've got less than 300 FTEs, it's $100 annually. So we're talking about really peanuts on the dollar. The cost savings that this presents alone on not having to go out to bid pays for itself. Some organizations also have consultants that might be on retainer. There's some that might take percentage cuts of the savings through the Healthcare Connect Fund if you're currently using one. We're not saying get rid of those folks, right? Because that's not what we're in the business of doing. But what we're saying is that there are also alternatives where you could perhaps use an organization like this to either work with that consultant or, as MICTA does, they teach people how to fish. And what they could do is teach you how to file the forms. And we'll talk a little bit about that here in a few minutes. But as they teach you on how to file the forms and go through the process and what to look for, you may not need that consultant at some point in time where you become very self-sufficient and you save money on the back end as well, whether it be the retainer or also be the percentage cut. So anyway, I wanted to point that out, that very trustworthy organization. I've worked with them for a long period of time. And gentleman that I mentioned a little bit earlier, Gary Green, is very, very well connected with USAC and with the FCC. So really how to get started. What you want to do is you want to look for your eligibility in the USAC Rural Search tool. Okay, so it's a website, like I said, on the usac.org site. It'll direct you to basically put in information as it relates to where you sit. You can also look at your prior USAC funding. So if you've had a consultant do this for you, or if you've had somebody internally and you want to just look at this stuff yourself, you can go out and you can essentially verify any funding that had taken place in the past, because this is all public information, and how you filed in the past if it was individual versus consortium. Through this particular process, again, if you have not done this, you'll want to understand how many facilities that you own that are urban versus rural. And again, if you have majority rural, you have the opportunity to actually take and replace, again, pieces and parts of this network to make broadband functional and to obtain the 65% subsidy to cross the entire consortium. And then also you want to look to see how you filed historically for connectivity in the past. Okay, so if make sure that broadband was being taken care of, and that's the first step really in this particular process. So if you haven't even done that, you're a little bit behind already, but you should take advantage of this because the money is there. It's for organizations to use. And so if you aren't using it, I would encourage you to dig deeper and to just make sure that you are obtaining the funding that is out there for utilization. Questions consider. So again, are you using the Healthcare Connect Fund program today? Well, are you even aware of the Healthcare Connect Fund? Those are things internally you can start to ask if, again, you don't, or you are not the subject matter expert, or perhaps somebody else might be on the administrative side. Again, have you received funds from USAC for broadband? And then again, the key part, right, is determining where there is a technology requirement that would drive a more sophisticated network. Again, is it end of life into support equipment? That's a relatively easy one because we know that that's not going to scale. We also know that there's costs affiliated with that, and you can replace those types of networks with new networks and maybe offset some of the maintenance costs and the support costs. So think about that, as you move forward. And, again, feel free to reach out to Juniper Networks and Bytespeed as you start to consider some of this. So leveraging the resources through the process, I mentioned Juniper and Bytespeed here working very closely together. So reach out to either one of us, right? So reach out to your local partner Bytespeed and we can start the process. They'll engage Juniper Networks. Our account team will get involved. I'll personally get involved as well. What we'll also do is we'll bring Gary Green from MICTA to the table. As I mentioned a little bit earlier, if you'd rather have those conversations without Juniper and Bytespeed involved, I'm all for that, so that, holistically a one-on-one relationship, you can get it right from the horse's mouth and what MICTA's value proposition is and how they possibly could help you without any sort of vendor influence. And I'm a big fan of making sure we're doing the right thing for our healthcare customers. And so we like to step out so that that conversation can be had. And then if you choose to go down and join the MICTA organization, we can jump back in and to help really essentially build a bill of materials and to help design and deploy this network that will help scale if you have 5 to 7 years or more. So Gary, as I mentioned, the consultant, Gary teaches people how to fish. He's very intelligent. He's very well connected to the USAC organization and the FCC. He'll jump in. He'll spend time keep teaching and coaching the folks who would be involved at a typical administrative side process. He will walk them through the forms process. What Gary does not do is he does not submit your forms for you, but he will look at them and he will review them and he will ensure accuracy. And so one of the beauties of that is that as you engage with MICTA, they do a fantastic job of making sure the T's are crossed and the I's are dotted, if you will, and they bat a very good high percentage on approval ratings once the 462 or the funding request is filed. Okay. In fact, I don't think they've ever had any rejected. So all good stuff. But ideally, again, we'd set up a scoping call after the interaction with MICTA had happened, if it's something you want to pursue. And then again, we'll talk about what the eligibility is, the opportunity, and how we move forward. At a high level, we talked on the filing calendar year what some of the forms were. I just want to be clear here. If you aren't familiar with the process, maybe this will dip your toe into the water, so to speak, and you're able to at least understand the typical form and the typical form flow. So a Form 460 is the eligibility and registration form. This is the basic site, information, contact eligibility information, signatures to actually, be signed up. Opposed, if you wanted to sign up as a consortium, you would have to file a Form 460 again to move from an individual to a consortium. So the basic information, again, you would need the information for all the sites again that would be part of the consortium, and that can go on that form as well. So that's really the kicker of getting started, right? And determining your eligibility. Then there's that Form 461 we talked about, which is the request for services. Now, this is the one that's for the competitive bid process, but it also is the form that's not required for exempted MICTA members, okay? The Form 462, as you heard me allude to, the funding request form. It's the information that's going to be submitted that's necessary for really understanding and USAC understanding what technology and services you are asking for funding and the 65% for. Okay, so that's the one that has to be submitted before the end of the funding year, right? And the calendar window was closing June 30th this year. And so again, the very important form of needing to get in before the deadline, the form that of all the technology and the services that you're seeking the 65% funding on. And the last form is the Form 463, which is the invoice and request for disbursement. So that's the official request to USAC for disbursement, meaning I'm going to get this back and I'm asking for I'm asking for the 65% subsidy. It's got to be filed within 6 months after the funding commitment. So anyway, that will kind of flow the process for you at a very high level, a summary of each particular form. And again, if you have any questions, don't hesitate to reach out to myself. You can reach out through Bytespeed as well, and we'd be happy to have some conversations. You can also go directly to the USAC folks as well. They've got information on their website that will direct you in the right place. They also have a Healthcare Connect Fund help desk, which you'll see on the second to last bullet there, 1-800-453-1546. MICTA has a help desk as well if you have some general questions as it relates to understanding their again, membership, also their value as an organization, maybe the historical perspective as their org has grown over time. But it's 888-964-2227. You also see in between here, some of the bullets are award from a Juniper perspective sitting on the MSA. Again, the FCC Connect Fund news release as it relates to the fund and the transition, right, that took place also between the Telecom Fund and the Healthcare Connect Fund. So with that, thank you for your time. I encourage you to reach out if you do have any questions, and we'll look forward to engaging with you where it makes sense. Thank you again.